How's it going, guys? We have a past level question for pathology for step one. This type of question, all over the NBME exams, just came out with a high yield pathology PDF yesterday. I'll link it in the comments below. 62-year-old woman has renal cell carcinoma. She has a biopsy. Question wants to know which of the following mostly indicate the need for nephrectomy in this patient. So they want to know which of these answer choices has the worst prognosis. So before I hop through, you should know grade versus stage. As I said, I talk about in the PDF if you want it written down. But grade is going to be your degree of anaplasia, not aplasia. Aplasia is lack of growth. Anaplasia is how immature the cells are, how undifferentiated the cells are, how much do they not resemble the native tissue. It's also number of mitoses, and they can describe number of mitoses in a few ways. They can say high Ki67 index. It's a protein that's present in rapidly dividing cells. They can say a 1-to-1 nuclear cytoplasmic ratio. That's a high, that's not low. Okay, so the nucleus should be a lot smaller than the cytoplasm, shouldn't it? So a 1-to-1 ratio means you have a massive nucleus, so that's high grade. Third finding they can say is prominent nucleoli, because nucleoli are where the rRNA synthesis occurs in the nucleus. So it means high protein synthesis occurring in rapidly dividing cells. That's grade. Then you have stage, which is degree of invasion / metastases. Okay, TNM, so tumor, it's just the size of the tumor, degree to which it's invaded. Is it present in the lymph nodes? Has it metastasized? So the key point you need to know that's past level for USMLE is that stage is more important than grade for prognosis. Some pedantic students watching this clip might say, that's not true, Michael. There's some brainstem tumors where grade is more important than stage. It's fucking wrong. Okay, so for USMLE, they want stage as more important for prognosis than grade. So when we have this type of question, they're essentially just asking which one has the highest stage. So let's just hop through the answer choice here. Choice A, high Ki67 index, and a 1-to-1 nuclear cytoplasmic ratio. These are two high grade findings. We say, okay, well, that doesn't sound good, but we don't know anything about stage yet, so we don't eliminate it, but let's just keep moving through. Choice B, low Ki67 index, 1-to-1 nuclear cytoplasmic ratio. That's a low grade finding with a high grade finding. Well, we can assume that this is fucking wrong because clearly A is more sinister than B, but we're going to keep moving through. Choice C, highly anaplastic cells with high mitoses, confined basement membrane. So we have two high grade findings here, the anaplasia with the high mitoses, but we know stage is 0, and we say, okay, well, this is likely to be lower in terms of lower on the hierarchy in terms of prognosis. Okay, it's not. It does not portend a poor prognosis. But we're going to keep looking at the other answer choice here. Choice D, immature morphology. So it's a high grade finding with high Ki67 index. Okay, so that's sinister as well, same as choice A, but we're still not sure. So what's going on here? Okay, I mean, what are we doing? So we look at the final answer choice. Well-differentiated, slowly dividing cells. Okay, well, that sounds good. So low grade. Confined, fuck am I saying? Deep to basement membrane. So this is the only answer choice. Choice E is correct. This is the only answer choice where we've denoted some form of increase in stage. Okay? And this is what the USMLE is going to do. They're going to give you a bunch of answer choices that sound sinister. Students like, well, choice C sounds really bad. You're right, but stage is 0, so it's fucking wrong. Choice Z doesn't sound sinister. Sounds not that bad. Okay, well differentiated, slow dividing. That's good, isn't it? Yeah, but it's deep to the basement membrane. And then you say, but choices A, B, and D, we don't know the stage. How do you know? I agree with you. Okay, and this is what NBME is going to do. They might not say the stage. So we conclude choice E because it's the only one where there's a slight increase in stage. It's not a high stage. It's not. It's only crossed the basement membrane. So it hasn't gone to lymph nodes. It hasn't metastasized as far as we're aware. So overall, in terms of cancer staging in the grand scheme of things, it is low stage, but it's still higher stage than the other answer choices here. You need to know also if they use the term microinvasion in the stem, say which of the following reflects microinvasion of a cancer, you just need to know that means crossing the basement membrane. Okay, so if they list answers like invades blood vessels, invades nerves, invades muscles, crosses the basement membrane, it's just cross the basement membrane, not difficult. If they say if they give you skin cancer, they say which of the following portends worse prognosis in this patient, and they say they have answer like cross the basement membrane, that's sometimes wrong if they list invasion into hypodermis as an example, because depth is most important for skin cancer. Okay, so you want to be careful. Yeah, it's not good if it's cross-based membrane. That is an increase in stage. It's not good, but it's worse if it's in the hypodermis, the subcutaneous tissue, isn't it? So be careful for skin cancer questions. Remember, depth of lesion is most important. Your short point of consolidation is that stage is worse than grade for prognosis for USMLE. You know the deal. I'm to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.